Hey everybody, welcome back to Fast Facts. So, if you're a fan of the sports world, sports ball, you know in the NFL there is a player named Aaron Rodgers who just had an Achilles tear about 70 something days ago and is already back to playing football. I thought it would be an interesting topic to talk about specifically an Achilles and its injuries. So that's what we're going to do today. Achilles injuries are often associated with the Achilles tendon, a strong fibrous cord that connects the muscles in the back of your calf to your heel bone. The most famous reference to an Achilles injury comes from Greek mythology, where Achilles, the heroic warrior of the Trojan War, was vulnerable in his heel. Here are some facts about an Achilles injury. Number 1, the anatomy of the Achilles tendon. The Achilles tendon is the largest and strongest tendon in the human body. It connects the calf muscles to the heel bone and is crucial for activities like walking, running, and jumping. Number 2, Achilles tendonitis. Achilles tendonitis is a common injury that involves inflammation of the Achilles tendon. It is often results of overuse, improper footwear, or sudden increases in physical activity. Symptoms include pain, swelling, and stiffness in the tendon. Number 3, Achilles tendinosis. This is a chronic condition characterized by degeneration of the tendon without significant inflammation. It is often a result of untreated or recurrent tendinitis. Unlike tendinitis, this may not represent with significant swelling but can cause persistent pain and weakness. Number 4, an Achilles rupture. An Achilles tendon rupture is a much more severe injury that occurs when the tendon is partially or completely torn. This can happen suddenly during activities like sprinting or jumping. A distinct pop sound is often reported following by significant pain and difficulty walking. Number 5, its risk factors. Factors that increase the risk of Achilles injuries include age, more commonly between 30 and 50, the sex, men are more prone, and previous Achilles injuries, flat feet, tight calf muscles, and certain medication. Number 6, treatment for Achilles injuries depends on the severity of the injury. Rest, ice, compression, and elevation, RICE, are often recommended for mild cases. Physical therapy, stretching exercises, and may be part of the rehabilitation process. Severe cases, especially ruptures, may require surgical intervention. Number 7, Achilles tendon lengthening. In some cases, individuals with chronic Achilles tendonitis may undergo a surgical procedure known as Achilles tendon lengthening. This involves making small incisions in the tendon to allow for increased flexibility and reduced strain. Number 8, the rehabilitation and recovery. Rehabilitation for Achilles injuries involves a gradual progression to strengthen the tendon and surrounding muscles. The length of recovery varies based on the severity of the injury, ranging from weeks for tendonitis to several months for a ruptured tendon. Number 9, to prevent Achilles injuries, individuals are advised to engage in proper warm-up and stretching exercises before physical activity, wear appropriate footwear, avoid sudden increases in training intensity, and address underlying biomechanical issues. And number 10, the mythological reference. The term Achilles heel has become a metaphor for a person's vulnerability or weak point. This phrase originates from Greek mythology, where Achilles was invulnerable except for his heel. He met his demise when Paris, during the Trojan War, shot him in the heel with an arrow, exploiting the singular vulnerability. How is this possible that a football player like Aaron Rodgers has come back so quickly from an Achilles tear? I'm not 100% sure, but it is pretty remarkable and shows how science has progressed. Anyway, please like, comment, and subscribe, and I'll see you all on the next one. Have an incredible day.